crunching the numbers, from the cost of health care reform to the reshaping of financial regulation.
What we should do is try to make sure the problem doesn't happen again and not use this crisis as an opportunity to create a huge new all-powerful bureau of government.
We've seen the government take over in the healthcare industry. We've seen the government take over in the auto industry. We've seen the government take over of AIG in the insurance industry.
One government takeover after another.
Europe's going broke because of entitlements. This is President Obama's big entitlement program, healthcare reform.
It will reduce our deficit by more than $100 billion over the next decade.
Healthcare reform will not cut the deficit, so says the CBO. That contradicts the promises from the Obama team.
Now, the Congressional Budget Office reassessing now how much the president's health care law will cost taxpayers.
The CBO has said that the entitlement program will now cost $115 billion more.
$115 billion.
$115 billion.
It's going to add another $115 billion.
$115 billion.
Pushing it past the $1 trillion mark over 10 years.
Which basically erases a lot of the savings.
Wham, bam, crank up the spending, man.
Here was one of the Democrats' primary arguments in favor of their health care bill, that it would lower the deficit. Yet now we're learning that it won't.
I believe that this bill, fundamentally, as it has been passed into law, is going to result in higher costs for patients. It's going to result in less access to care for people all across America, and it's going to result in unsustainable spending.
Crushing debt and out-of-control deficits
drive up the deficit and the debt.
Huge pyramid of debt. 30% of the people in this country's number one priority that they think we ought to be in jobs, it's spending, deficit, and balanced budget. They understand they're going through it right now. They have to make hard choices, and they think we ought to be doing the same thing rather than kicking the can down the road and charging it to our grandkids.
Healthcare has become a proxy for a broader set of issues about how much government should be involved in our economy.